Hi, Ms. Pepin, and welcome. Thank you so much for agreeing to do this interview. Can you share a little bit about yourself and your background and what led you to specialize in lymphedema therapy?
Sure. Um, I've been a physical therapist for over 40 years. And in the early part of my career, I did not do cancer and lymphedema work. I worked in acute care hospitals and I did neurological rehabilitation. But at some point, I guess in the 1990s, I worked in a big cancer hospital. And that's where I first became familiar with lymphedema. I had never heard of it before. Um, and so I took some training classes. And I was all set to kind of get going. Um, then my life went on pause for a little bit. I moved around the country. Um, and so it took another 8 or 10 years before I kind of got back to it. Sometimes that happens with life. So in 2013, I was given the chance to start a lymphedema clinic at place where I was working called Palo Alto Medical Foundation. And I was really excited to do that. So I retook a certification class because things had changed and it was much more formal at this point in time. And then from then on, that's what I did for like the last 10 years. And I find that not only working with people with lymphedema, but cancer, all the other various things that I had done, orthopedics, about things working with people with balance, chronic pain, all help contribute how I work with this population.
That sounds great. So, can you tell our viewers what exactly is lymphedema and why does it occur, particularly for breast cancer patients?
Sure. Um, Lymphedema is, in its simplest form, a buildup of excess fluid in the body tissues just underneath the skin. The buildup causes swelling, also known as edema. With women with breast cancer, it will occur in the arm, the chest wall area, occasionally the breast. There are other types of lymphedema, but that's where things happen with women with breast cancer. Um, the important thing to recognize is that lymphedema differs from other kinds of swelling. For instance, if someone sprains the ankle, it can cause swelling if they bruise themselves, or even when you have surgery, you may have swelling after surgery. These are not lymphedema. So the lymphedema associated with breast cancer is called secondary lymphedema. And the way that we recognize it is that it doesn't go away. Long after the normal postoperative period, it just hangs around. And it's due to a combination of factors that happen with cancer treatment: surgery, radiation, removal of lymph nodes. So all of these can lead women to get breast cancer related lymphedema.
Oh, so, and then you touched on this a little bit with the fact that the swelling doesn't go away, but are there any sort of early signs or symptoms that women should watch out for?
Yes. So the early signs and symptoms of lymphedema will vary tremendously, but probably the one that they notice the most is a feeling of heaviness or achiness in that arm. They may notice some swelling, and sometimes the swelling could be slight. So I've had women who've noticed swelling just like in this little part of their hand, while others notice it more up in the armpit or axillary area. Um, Other signs might be like a mild swelling of the chest wall. Not all breast cancer lymphedema occurs in the arm, although that's the most obvious one. Um, Also, things like a feeling of fullness in the arm, even if the swelling isn't obvious, skin discoloration, your skin might change a little bit, become drier or feel thicker. They may get like kind of an achiness. It's not so much of a sharp pain, but kind of like a dull achiness. And the last thing is they have a lowered immunity to infections. How does someone know that? Um, they may get a cut that doesn't heal on that arm, where before, like it would heal in 2 or 3 days. They may get something like on their fingernail that just like kind of lingers around for a while. So those
Oh,
would be some early signs.
okay. And then how can lymphedema impact a patient's quality of life if it's left unmanaged?
That will vary for everybody depending on the severity of their lymphedema. So for some women, and I'm going to use that term women, but um, breast cancer can occur in men as well, not to confuse the picture. Um, some people who have just mild symptoms, it actually may not bother them that much. They may wear compression sleeve and the swelling shows up just when they do heavy work. But for the people who have more moderate to severe lymphedema, it can progress slowly over the years. And that can lead to changes in the mobility of their arm. It can, they may be, well, there will be an increase in the amount of swelling that's there. They have an increased risk for infection, discomfort. If their arm gets really big, they can start to lose like the ability to move some of the joints in their hand or their arm. And then very practically, it's it might be hard to get certain clothing on. It changes their body image, which is already a big issue when if a woman's undergone surgery for breast cancer, is now you have something that tells everyone that you had something done. So that's actually one of the changes that it can affect.
Yeah. And then what are some of the biggest misconceptions about lymphedema that you have encountered?
I like that question the best because there's a lot there's a lot of them that I've seen over the years, but I chose like three of them. Uh, that's a great question, by the way.
Thank you.
Probably the biggest one is that it can be curable. Um, and people feel that um, if they do everything right, they won't get it. Well, it'd be nice, but sometimes if you had 25 lymph nodes removed, you can do everything right. You may not get it as soon. It may not become as severe, but you'll still get it. So the curable thing also has gained more traction because even though it can be managed, I'll put it this way. So there's been some recent surgical advances that claim they cure lymphedema, things like lymph node transfers, um, and some other ones, which I'm not going to name here. The problem is that very few surgeons are trained in these, and very few university hospitals have or operating rooms have that ability to do these surgeries because they require really specialized equipment. The reason why there's so few people trained in this country is that insurance companies don't pay for them. So you have something that only an elite few people can get, and it's not practical for people in many states, or even in this area where there may only be one or two hospitals and one or two surgeons that do these procedures. And even those procedures, when they do them, they don't have a 100% success rate. So I think that's the key issue is that it is something they have to manage. And initially, when we tell people that, no one likes to hear that. Some other things, and um, many of these are based on older information when women used to have much more invasive surgeries, is that they shouldn't use their arm at all. They should protect the arm. They can't do weight training. Um, and some doctors will still tell their patients, don't lift more than 3 pounds for who can get away with that for the rest of their life, right? You have a grandchild weighs 8 pounds at birth. So it's kind of like these things have no basis in research. And if anything, the research has shown that weight training can be helpful in keeping the arm active and as part of the self-management. So that's a big urban myth that we work hard to get rid of when women come to us. The last misconception, which thankfully is getting a lot less in this country, is that if they get lymphedema, it's going to lead to a big arm. And this fear is very common among any younger woman who had a mother or grandmother who got cancer surgery 25 years ago or more and actually did get severe lymphedema and got a gigantic arm. You may see this also in other countries where some of the surgical techniques or early detection is not as prevalent. Today, we don't see that advanced stage of lymphedema that much unless it's been someone who's had that surgery a long time ago. And that's because many women today um, are diagnosed at an earlier stage. So their surgeries don't have to be as invasive. Also, um, there are some newer techniques that are helping surgeons. They really try to minimize the amount of lymph nodes they remove. And again, in some of the um, I should say like the more fancy or university-based operating settings, they'll have specialized equipment that guides and mapping that some surgeons can even, with microsurgical techniques, be very specific on which lymph nodes they remove. These latter techniques are not available to a lot of people, but in general, we don't have the extent of invasive surgeries that we had in the past. So those are some of the common misperceptions.
Yeah, no, those definitely sound like things that I can imagine a lot of people aren't aware about.
No, yeah, and if someone has seen like their family members go through this a long time ago, it sticks in your mind.
Yeah, definitely.
Yeah.
So, what steps can patients take to reduce their risk of developing lymphedema? I know a lot of times it's not something that you can completely prevent, especially with complicated surgeries, but are there any steps that people can take?
Yes. And you are exactly correct. The largest risk factors for developing lymphedema are the amount of lymph nodes removed and whether someone has radiation. These two things a patient will have little control over because those are necessary to fight their cancer. But then there's the stuff that they can do. So actually, surprisingly, what's come out in a lot of studies is obesity. Women who are obese, if you look at and have the same amount of lymph nodes removed, women who are obese have a greater risk of developing lymphedema. Okay, so weight management can be helpful. And then there's the matter of many people don't get lymphedema right away. And when we look at the triggering factors, what are those things that a woman can control? So things that can control that we've seen as triggering factors are, or things that you can control are good skin care. And I'll talk a little bit more about that later. Staying active, trying not to get sunburned or things that will really stress that arm or body part out. Taking care of things like puncture wounds. So that may sound kind of weird, like, you're not going around stepping on nails, but if someone goes home, they start to feel better, they garden, they get stuck by thorns, they get stung by a bee outside. Those things contain, their body can't fight the infections that can occur from these simple things. And we take it for granted our lymphatic system fights these things. Now they can't. So they get an infection, and the infection puts a stressor on the arm, and that triggers their lymphedema. So we give people practical advice like, hey, if you're going to go out hiking, take some little alcohol swabs with you. You know, if you're out in your yard and you cut yourself, don't just ignore it. Go inside the house and wash the wound with like soap and water. Also, if someone does develop a myelymphedema, we encourage them to wear appropriate compression to control the swelling. In California, sometimes it's a hard sell. It's hot. And so we have them pick and choose their battles because they're more likely to develop swelling if they're outside and sweating a lot. And so what can they use? What simple things can they use to try to help that out?
And then if a woman in a low resource setting doesn't necessarily have access to a lymphedema specialist, what strategies do you think she could use to help prevent or manage symptoms?
Again, a really good question. Um, as a lymphedema therapist, our focus is to actually teach people self-management. Um, so many people we only see for 3 to 4 sessions to kind of tell them how to take care of things or how to prevent things. Um, and so the four principles that we emphasize are things that anyone can do with this condition. Um, and even in the United States, there's not a lot of lymphedema specialists. So the few times when people might be on a more prolonged course, even then they might see people for 6 weeks and then they're kind of on their own. The first principle is learning that self-manual lymphatic drainage, sometimes known as self-massage. And what MLD or manual lymphatic drainage is are very gentle and specific massage-like treatments that reroute the excess fluid from the body area that's congested to other areas that aren't, whether your lymphatic system is working. And this can work with any type of lymphedema, whether it's in the chest wall, the breast area, or the arm. The second area of self-management is exercise, moving. So the ideal exercise is focusing on gentle contractions of all the different joints in the arm. Um, and exercises like swimming, yoga, and Tai Chi, which also involve a lot of deep diaphragmatic breathing, are the best. However, not everyone likes those things. So it can be anything. It could be like just taking a walk and letting your arms swing. It could be people can go and play tennis, lift weights, do Pilates, and do more vigorous things. There are women who work using their arms. They can kind of go back and do that. If someone does develop lymphedema, we encourage them. This is where they may need to wear compression to control it. And we'll talk about this in a bit. Um, Skin and nail care, again, are really important self-management tools. And I've already touched on that. But again, taking care of wounds or trying to really anticipate situations that could get somebody in trouble. So I'll give an example is I like to walk around barefoot in my yard. If I were to develop lymphedema in my leg, I wouldn't do that anymore because I might get myself cut or I might get something that wouldn't heal. Now, if it was on my arm, it wouldn't matter. So it's kind of like, okay, I've got this. It's like, what can I do to minimize my risk? Uh, Also, wearing like tight clothing on that body area can be something else they can do. Um, for people who like to cook and bake, um, use protective gloves. This may sound silly, but if you've ever had, if your mom or your grandma likes to cook and they just, how often have you seen someone just go in the oven, pull
Oh,
something
yeah.
out with a little towel, right?
Mhm.
Okay, that is a bad idea because then you can get burns over here. So it's like, so we go through and we tell people, okay, be careful with this. Also avoiding becoming sunburned. So those are the practical things. The last part of self-management is compression if someone does develop lymphedema. And in this country, there's a number of resources or places where people can get, unless they have a really large arm or misshapen arm, they can get low-cost compression sleeves. These may not be available in some areas. So we don't want anything tight like directly here because that might actually create like a tourniquet effect and make the arm more swollen. But they might wear something at least on the hand.
Okay.
So things that I've encouraged people to do if their lymphedema was mostly in their hand is to like wear a batting glove or some kind of glove that's fairly close fitting. Um, Depending on the area of the world or the country, there are things online that can be bought, and some are less expensive than others. There are more breathable fabrics that maybe the level of compression is not as high um, as the traditional, the classic kind, but even a mild compression would be helpful. Um, an example of like a if someone had truncal lymphedema, meaning like in the body area, I might recommend I'm trying to remember the name of like the rash guard shirts that some of the surfers use. Okay. Or for men who might get lymphedema of the trunk following uh, a different kind of cancer, they, will recommend like the body armor or some of those like kind of like more skin tight clothing. that you can even sometimes get from Walmart. It's not ideal. It's not medical grade compression, but it's something.
Definitely.
Yeah.
Well, thank you so much for all of this amazing information. Was there anything that you wanted to add which my questions didn't cover?
No, I thought they were really well thought out. Especially, like I said, I like the misconception one, and also like what people can do because you don't even even locally it it's hard to get into a lymphedema therapist. There's not a lot of them, and their schedules are full, so you might have to wait 6 or 8 weeks. So it'd be great to have some practical information out there
Mhm.
that people can listen to and or have like a checklist or something like that.
Yeah, definitely. Well, thank you so much.
Yeah.